existing SCA, they have to file a brief, and it goes to the Department of Health and Human Services, and the Department of Health and Human Services decides if that state can get that waiver. What the very specific language in this bill does is it changes that waiver process to a single executive decision, meaning a governor fills out the form and that's it. There's no legislative input, there's no input from DHS, it's only the decision of the governor. Since all of you know someone who has cancer, how many of you think cancer is going to be on the list of pre-existing conditions that are not going to be covered if this Senate bill is passed? Okay. So the other thing, one of the other aspects of the language in this bill that is going to very specifically impact cancer patients is the reinstatement of the ability of insurance companies to write into your policy both an annual cap on coverage and a lifetime cap on coverage. Now, as Sandy said in my introduction, I just this week celebrated my 6th year as a metastatic breast cancer patient. A lifetime cap for coverage in most instances is usually somewhere around $1 million, because $1 million sounds like a lot of money. Okay, and it kind of sort of is, in the million you do $1 million here and $1 million there, and in a little while you got some real money going. Okay, but in cancer treatment, $1 million barely gets you a seat at the table. I passed the $1 million mark within the first year of my treatment. There are some cancer procedures now, some treatment options now, some chemotherapy options now that cost $300,000 per treatment. The kind of coverage that this bill will enable it's zombie coverage. It's worth nothing. One other thing, and previous panelists had mentioned this, there is something called essential health benefits, EHBs. An essential health benefit there is a list of procedures that was designated by the ACA that insurance companies had to cover. Among them, mammograms, colonoscopies, prostate exams, pap smears, MRIs, all of these things that are preventative and issued for cancer screenings depending on your risk profile. This legislation, the specific language of this legislation, does away with the entire concept of EHBs. There are no more essential health benefits. Does away with that language. So your insurance company does not have to cover your prostate exam, does not have to cover your colonoscopy, does not have to cover your MRI. If your granddaddy died of kidney cancer and your daddy died of kidney cancer, and your general practitioner says, you know what, you're 50 years old, and your risk profile for kidney cancer is quite high. We need to go ahead and get you some screening earlier than what is usually recommended. Your insurance company would not have to cover that screening if this specific legislative language is passed. So that's right now, there are 2 million cancer patients who rely on Medicaid. Fully 1/3 of the children who are diagnosed with pediatric cancer are covered by Medicaid at the time of diagnosis, and usually within that treatment, the level of Medicaid coverage goes to 60 or 70%. This is a horrendous bill whose idea is predicated on the notion that people are disposable based on their health and their wealth. And thank you.
Well, I'm the last person, so the risk is everybody said all the good stuff, and but I'm going to try and because I've been listening carefully, and I just want to make 3 points, and I come to a certain conclusion. So the first point I want to make is that, as many people have alluded to, we all benefited from the ACA. It isn't just the people who got covered with insurance because they got Medicaid. It isn't even just the people who got a subsidy because of the marketplace. That's what we always focus on. But I'm really speaking to the working class voters of Tennessee and the United States. And you have to understand, folks, that you benefited from the ACA. And you benefited in the ways these people have talked about. It got rid of this pre-existing condition elimination. It got rid of things like community rating, which basically means that you now cannot charge 2 people the same age, one healthy, one sick, a different premium. You used to be able to do that. The elimination of lifetime caps that we talked about. These are all things that benefited all of us, whether we get a subsidy or not, whether we got Medicaid or not. We all benefited. So that's my first point. So that's the good part of the ACA. But here we are 7 years later with a Republican Congress and a Republican president, and I accept the fact that Republicans are the part of our society who, God bless them, pay a lot of attention to money and wanting to make sure that it gets spent in a good way and not wasted. So I'm not here to badmouth half of our society, and I respect the concerns that they have, which are concerns that we also all have. The ACA costs too much. It has not controlled the cost of premiums. The cost of premiums has skyrocketed. It has not brought down the cost of health care. You better believe a $1 million lifetime cap is, you're screwed with that if you have cancer. So the good part of the ACA is it got rid of a lot of these, or it put in provisions that we all benefit from. The unfortunate bad part of the ACA is that it did not control costs. And so I get it that a whole lot of people voted for change, and specifically what they voted for was someone who said, I'll cover everyone, lower premiums, and improve choice. Well, that's a winner for me. Unfortunately, you can't do that and leave the for-profit insurance industry in the equation. So they found out this is a lot more complicated than they thought. And so instead of keeping the real promise What they're doing is, what the GOP is doing, I'm sorry to say, is number one, a whole lot of wordsmithing to convince the American people, including the American people who voted for them, that what they're going to be delivered is actually meeting the promise of covering everyone, which it isn't, lowering premiums, which it is for possibly young, healthy people at the expense of the 50 to 64-year-olds and the disabled and other people. And improving choice. Well, let's talk about choice. I think what they're talking about, the GOP, is improving your choice of how much money you have to spend so you can have more choices of different insurance plans. And you'll have the choice to pick a plan that you can afford. Well, that's great as long as you're young and healthy and never have to use it. But let me tell you, the only way you can have a premium that keeps the cost down is by using a mechanism called cost shifting. And what that means is your deductibles are sky high, your co-pays are sky high, you're not covered for the essential health benefits. So all of a sudden you realize, you pull out that piece of paper and it isn't worth the paper it's written on. It's simply not enough. So what are we to do? Well, I would say that we actually, I don't believe there are any unsolvable problems. I think that there is a lack of political will to solve the problems, and that's another issue. But this is not an unsolvable problem, because every other developed country in the world has already solved this problem. What we have to do to fix the ACA is not a public option where you can, if you want to, you can buy into Medicare. For lots of reasons I won't go into, that won't work. I say we need a private extraction rather than a public option. The private extraction being the extraction of the for-profit insurance industry from the equation. If we eliminated profit and bureaucracy by eliminating the for-profit insurance industry, we gain $500 billion a year. Add to that another $100 billion in negotiated drug prices, we're up to $600 billion a year. And guess what, folks? That's enough to cover everybody, and meet the actual promise that the president gave us. Cover everybody, lower cost, and increase. What choice?
Yeah.
Is it the choice of a plan? No, we're all in the same plan. What do we actually get the choice of? Any doctor, any hospital, anywhere in the United States. I think that's the choice we were actually talking about. So I think the solution is Medicare for all. Improve it, expand it, give it to everyone. If you want to learn more about that, you can go to www.pnhp.org. PNHP stands for Physicians for a National Health Program. The legislation is H.R. 676, which is the improved and expanded Medicare for all. Stay tuned. Senator Sanders says he's coming out with a companion bill soon in the Senate. Thank you.
Thank you. About 40 minutes questions. I think finally the rain has stopped, so we'll be able to hear over that. All right.
Hi, Mariah Phillips. I wanted to comment on the choice piece because I've always been given, looking around, I've always had healthcare through my employer. And so while it's always been reasonable care, it has removed any kind of choice for me, because the person who truly had the choice was either my employer, who chose what health insurance company I could use, or the insurance company who then choose what doctors I can select from. So I want to say that I really enjoy the way that you presented the choice, what choice truly should be for the patients that need to use it. So anyway, that was more of a comment than a question, but I think that's the choice that we are all looking for.
And I think, and I agree with you, that's the choice that I think people thought they were voting for. That's the problem I have with all the wordsmithing. Oh my gosh, Senator Alexander is a master at saying things that are technically sort of true. Whoa.
Slightly true.
Slightly true. But drill down on them and.
You talk about the issue of choice. That was what was promised. You referred, Carol, to the promise of choice. Well, you've got cover everybody, lower cost, and more choice. What choice do you really have when you pay a premium for a policy that has a $6,000 deductible? $6,000 before you can put your foot in the door. So here's what happens. Let's say maybe you got a family policy, and this was what we would call in the industry a distress policy. I mean, a stripped down, the EHBs are gone, no more of that foolishness. Essential health care benefits that preserve and lives, that make lives better for all of us, that's gone. But you got a stripped down policy, and maybe it is affordable at $400 a month for a family plan. Well, you got a $6,000 deductible. You have a child who comes down with a high fever, and you think this could be something serious, but good grief, I can't afford that $6,000 deductible. So you just don't go to the doctor. Or let's say the 45-year-old steel worker develops a pain in his chest, and it just doesn't go away. $6,000 deductible. What am I going to do about it? I'm just going to see if I can wait it out and see what happens. What this does, this has the effect of making people's health worse, and when they finally do go into the health system, after their health condition has deteriorated over a period of time, the cost of caring for them is catastrophic. So it's a false economy. I mean, you try, it's what they call, penny wise and pound foolish.
Yes.
You squeeze the balloon down here a little bit to extract the cost savings, but that balloon's going to expand tremendously in the other direction. Here's an effect. Here's an effect of elimination of the essential health benefits, the EHBs that we talked about, that are now in the ACA, that would be taken out in the Senate version or in the House version. When you remove the preventive care and the routine diagnostics that we need to stay healthy or to know what our health condition is, what you're doing, you're going to contribute to the soaring cost of end-of-life care. A big part, you take a look at Medicare expenditures, a huge part of that is end-of-life care. When the situation is basically inevitable, this end-of-life care. So it's clever. It's diabolically clever. What they're doing in stripping down Medicaid, they're forcing more people, if they live to be 65, over into Medicare. Well, that's a whole different issue. We don't have to talk about that today. We don't have to talk about Medicare. When that crisis hits, are we going to have the policymakers and the politicians who will stand up and do what they need to do? You are setting the clock on a time bomb when you do this.
If I could build on what Bill just spoke about, I'm gonna tell my story of why I am sitting here, a terminal breast cancer patient on Medicaid. In my early 30s, in my late 20s, I helped a family member start a business, and I was running that business in my early 30s, and I had private insurance. We we were a small construction development company, and I had my private insurance. Very affordable, okay coverage, everything was fine. A couple of weeks after my 33rd birthday, I woke up in the middle of the night having a heart attack. I was rushed to the emergency room. 12 hours later, while I was still when I was in ICU, I had another heart attack. That was in September of 2002. And by the end of December of that year, I'd had a total of 5 heart attacks. I was rolled, dipped, and died through everything that General Electric Medical Imaging Division had on the market at the time. We finally figured out that I had an unbeknownst to that point, genetic mutation in my red blood cells that caused my red blood cells to clot more than is healthy. Over the next about 2.5, 3 years, my private insurance company, because I had started to use my insurance and then being diagnosed with a genetic condition, my insurance premiums doubled for less coverage. Then they doubled again for even less coverage, and then they doubled again. I was up to, I went from $127 a month and a $1,000 deductible and a $15 copay to over $900 a month for a $10,000 deductible and a $50 copay. Couldn't afford it anymore. And it was, honestly, it was coverage that wasn't worth the paper it was written on. So I contacted TennCare office to find out if I was eligible for TennCare. They said, well, we can't even talk to you if you've got coverage. You're gonna have to drop your coverage. You're gonna have to be denied coverage from someone else, and then you can come back and we can start the process. So that's what I did. I dropped my coverage. I applied to 3 different insurance companies because I wanted to be thorough. Was denied by all of them. In this time period, the state legislature passed some big cuts to TennCare that changed the scope and the scale of the program. I went back to TennCare. They said, sorry, enrollment's closed. There are no more sign-ons for adults. Thanks. So that was in about 2007, 2008. So I had no insurance. We had a recession. My background was in real estate and construction, so you can infer from there what my employment prospects were during that time period. I worked part-time, small-time jobs, trying to get things together. I sent my daughter off to college the fall of 2010. She came home over Christmas break. While she was home on Christmas break, I found a lump in my left breast. I convinced myself that it was a fibroid, and I went on about my life. A few months later, could no longer deny that it was a problem. The lump had doubled in size, it changed shape. I went trying to find a general practitioner or some doctor that could give me the necessary screening and referral for a mammogram. That process took a while. No one was really excited to make room in their schedule for someone who was unemployed and was going to have to pay cash for all of their services. I finally was able to find a provider. That provider, by the way, was Planned Parenthood. And I went to Planned Parenthood, got the necessary screenings that I needed and the necessary referral for a mammogram. And June 30th, 2011, my mammogram was severe enough to be immediately positive for cancer, and I was enrolled in TennCare. A few weeks later, after more testing, it was found that the cancer had metastasized to my spine, and my diagnosis was stage 4 metastatic breast cancer, aggressive, had 6 months to a year to live. the good taxpayers of the United States have now been out several zeros, several commas involved in the amount of money that's been spent keeping me alive these last 6 years. Most of which could have been avoided if I'd been able to have access to basic affordable health care in my late 30s and been seeing a general practitioner, been having that annual breast exam and been referred for a mammogram when something showed up earlier. Now, breast cancer is a tricky thing. There's no guaranteeing that it could have been caught, but we don't know. This could have been a really weird story that I told over drinks to friends about the time that I came up with stage 1 and, you know, had a little bit of treatment and got some neat scars and maybe a tattoo and, you know, ran a couple of Susan Komen runs and that, you know, and that was it. But it's not. This is going to end my life. I'm not going to be founding any more companies or employing any more construction workers. That productivity, those taxes that I paid, those taxes that my companies paid, taxes that my employees paid, it's not there. All for the price of an office visit and a mammogram. Now, I'm going to tell you right now, there are people in this state right now who know something is wrong. There's a lump where there shouldn't be a lump. There's pain where there wasn't pain before. There's a cough that won't go away. And if this bill passes, those people are going to die. Now, this is the last thing I'm going to say. Budgets are moral documents. This piece of legislation is being passed through the budget and reconciliation process. This is a budget bill. This isn't a health care reform bill. This is a budget bill. This is a tax cut for people making over $1 million a year and a tax increase on middle-class families and a burden for the old and the sick.
And disabled.
And the disabled.
And the children.
Budgets are a moral document. This is a statement of who we are, what we value, what we believe in, and what direction we think we should go in. I want you today, when you leave here, each of you, write your senators. Call your senators and do it every day. Let them know that you are aware of the issues, you know what this legislative language means, you know what you want them to do, and if they don't do it, you are going to hold them accountable. You, citizens in this state, are the only thing standing between me and an untimely death. And I need you to show up. Thank you.
Powerful statement.
Questions? I have a question. What would universal care coverage look like? Would there be subsidies? Would there be tax credits? I mean, how, if you were president of the country, or maybe just the head of the Senate, what would you do? Give us a picture.
Did everybody hear the question? What would a Medicare for All program look like? Would there be subsidies? Would there be premiums? Things like that. What the bill actually defines is a single pool, risk pool, because that's really what insurance is about. Insurance is about managing risk. And we know that if the risk pool is bigger and bigger and bigger and has more and more and more people in it, then we also know that at any point in time, only about 20% of people are sick and using health care. So the trick with what we have right now is we don't have one risk pool. We have a bunch of little risk pools. And what happens when you have a bunch of little risk pools is you don't have enough people in there, and you've got to spend a lot of money to do two things. One is cherry pick all the healthy people into your plan, and the other is lemon drop, get all the sick people out of your plan. Otherwise, you're not going to make money. And let's not forget that the goal of a private insurance company is to make money. The goal of a single risk pool that is managed by a quasi-public organization, let's call it Medicare for All or the Centers for Medicare, they don't have a fiduciary responsibility to turn a profit. They have a fiduciary responsibility to be the best stewards they can be of all our tax dollars. And since all of us are in the same boat, from the president down to the custodian that empties his or her trash can, then we all have skin in the game to make the best decisions about how that money is spent. So, short answer is everybody's in one risk pool, and that's called the single payer. As far as the delivery of care, we're not recommending changing that. Some doctors and nurse practitioners are going to be in private business practice. Some are going to be employed by large group practices. Some are going to be in the, work in a hospital. So
Work groups.
Work with different kinds of groups. So it's publicly funded, privately delivered. You can think about Medicare, which people over 65 have now, but it's actually kind of Medicare on steroids. It's really good Medicare. Medicare without co-pays, Medicare without needing to get a supplemental policy. Get rid of Medicare Advantage, don't need it. We wrap all of the other plans into Medicare. So Medicaid goes away, and the S-chip goes away. We don't need all of those. And that's the beauty of it, because we get the economy of scale with a national health program. So it's really just a very sensible, conservative solution. The only thing liberal about Medicare for All are the benefits. It's really good benefits.
Well,
This all sounds fine, and I'm all for it. But until the United States